I'm Dr. Nicole Grieselhuber. I'm an assistant professor in the Division of Hematology at The Ohio State University, and I'm excited to share about our study of SEA CD70, a non-fucosylated monoclonal antibody directed against CD70. This is a dose finding and dose expansion study in high-risk MDS in combination with azacitidine. This is a cohort of mostly elderly patients. Median age was 72, and we investigated two different doses of our antibody, 10 milligrams per kilogram and 20 milligrams per kilogram, in combination with 7 days of azacitidine. And we found that this combination was well tolerated. The adverse events were really akin to what you expect with azacitidine. The main adverse event associated with the antibody itself was infusion reactions that occurred in a minority of patients. And this is obviously an early study. The data are preliminary. And the end primarily was safety, but we did observe an overall response rate of 44%, so we think that this is encouraging activity. We also saw that 16% of patients were able to proceed to allogeneic stem cell transplant, which we think is exciting, especially in a cohort that is elderly. So we're very excited about this study, and next steps are we're expanding the 20 milligram per kilogram cohort, and we're really excited to see where this program goes and further develop it in myeloid malignancies. I think that in myeloid malignancies, there's a lot of interest in finding surface targets that can be developed for antibody-based therapies. And I know that in the field, there's been a lot of interest in targeted therapies against specific mutations, but a lot of patients don't have targetable mutations. And so I think there's really a need for drugs that are broadly applicable. CD70 is expressed on the blasts in high-risk MDS and AML, and it doesn't really seem to be associated in particular with any mutation, so we think this is broadly applicable. So I think one of the big selling points of this drug is it's very well tolerated. It's given every 2 weeks. It's given as an outpatient infusion, so patients don't have to be hospitalized. There's not a lot of monitoring that has to be done after the infusion. So I think, especially in an elderly population, developing drugs that are both efficacious and easy to tolerate and don't contribute to worsening in quality of life is really important.